Welcome to our latest episode of the Lebanese Physicians Podcast, and this will be episode 104. And today we'll be talking about epilepsy and epilepsy medications in Lebanon through the crisis with Dr. Karine Abou Khaled. Dr. Abou Khaled actually did her neurology residency at Drexel University in Philadelphia, and then did a epilepsy training at Columbia University, and then afterwards decided to move back to Lebanon to help the patients in the country, and she has been a great asset. She currently works at Université Saint Joseph at the hospital there. Welcome, Dr. Abou Khaled, to the podcast.
Hi, thank you. Thank you for hosting me.
So, Dr. Abou Khaled, you recently, I mean, you've been very active as a neurologist in Lebanon. I know I was just talking offline today that we have met in person a number of years
Yeah.
ago,
hmm
and you're very active from a medical standpoint, but I know also you and your husband are very active also from a you have a winery and
This is what's good about Lebanon. You can do, I mean, still, despite everything's going on, we are still enjoying it. We are still resisting, and we hope we can, do this for a longer period of time.
yes, I hope so too. And
Yeah.
what we want to talk about today is majorly first is the paper that was recently published by your group in regards to access to epilepsy medications in Lebanon. And can you tell us a bit like how epilepsy care has been affected by the economic crisis in Lebanon that started in 2019?
Yeah, sure. As you know, Lebanon has a very particular healthcare system. We have it's mostly private, but we do have some medications that were subsidized and were covered by the Ministry of Health, by the government. So when the crisis started in 2019, it was initially, the revolution, and then we had the bank crisis, the devaluation of the money, and people could no longer actually access their bank accounts and withdraw money to buy medical insurance, to buy medications. And this is when we really went into this vicious cycle. And at the same time, because of the corruption we have in this country, we have some medications that was actually, I mean, we thought we had, let's say, this amount of medication, but they were actually getting trafficked outside the country. Okay, so what happened is suddenly patients faced lots of obstacles. Okay, and they couldn't really get their chronic medications. And it's not only for epilepsy. We had this with patients who had diabetes, who had hypertension, cancer patients. So it was really a tremendous problem. And with people with epilepsy, it's not easy to change anti-epileptic drug, anti-seizure medication. For someone who's been stable for a while on one particular medication, even sometimes when we switch in between generics, we have breakthrough seizures. So what if suddenly these patients just find themselves with no medications at all? And even if you had the money to buy the medication was not available. And there were multiple reasons. So what happened is I personally work in a university hospital. I have a subspecialty in epilepsy. So more than 70-80% of my patients are people with epilepsy. And at the same time, I'm a co-founder and the president of Epsilon, which is an NGO for epilepsy in Lebanon. So we sensed this actually several months before October 2019, when the actual crisis started. And when we felt that medications were getting more expensive, people were not I mean, people were not finding their medications easily. And as an association, we did like one very like a good action in the summer of 2019, where we decided to buy medications. Okay, we got a discount on buying medications, and we delivered medications to needy persons. So imagine, this really started to boil in the summer, October, November, and then there was COVID. And at the same time, COVID with the bank crisis. So things got really so difficult to the point where when we did this survey, we found that more than a third of the patients had to change medications, and 18% actually stopped taking their anti-seizure medication. And when you say a patient with epilepsy who stops taking the drugs, then he can go into status epilepticus. You have higher risk of injuries, presentation to emergency room for that. And then at that time, there was no longer coverage by health insurances. So the patient would go to the emergency room, would be charged a high amount just for the emergency visit. It could be equivalent to his monthly salary. So patients were actually avoiding going to the hospital, and this is where we had this high burden of morbidity, mortality, and this affected their quality of life, their mental, their social, the social also impact. We've seen a lot of issues along that line.
Yeah, because as you said, seizures for people also who are non-medical, they can affect, if they happen frequently, they can affect or have permanent dysfunction in the brain, and can even kill people, I guess, if it's like a uncontrolled seizures and people cannot protect their airway, and they may not be able to breathe, and they could pass away. So yeah, it's a big issue to change seizure medications and potentially run out of your seizure medications. So basically, when you did the study, and we'll talk about how you published it, so how did you decide, you know what, I'm seeing all of this, how did you decide I'm going to look into this and see how many patients are affected by this crisis and not getting their seizure medications?
Yeah, I mean, at that time, as you know, I work in a university hospital, so we have medical students, and these medical students have to publish a thesis when they graduate. So I had, and here I really want to congratulate Joseph Smeha, who was the intern who worked on that project, and he is now in Texas doing research in neurology, actually. So, and he came to me and he's like, I want to do something, and he was interested in neurology. And I said, well, see how many messages I'm getting from patients, because patients were sending messages and pictures of medications, because everybody in Lebanon, every person has a relative somewhere in Europe, in Turkey, in Canada, you know, and they were sending me pictures from pharmacies or from, you know, from all over the globe, asking me whether it's okay to take this medication. So I said, Joseph, well, see, look what's happening. Why don't we look deeper into that and see what are these patients doing, and let's look at their quality of life, because I started seeing more and more depression, sleep issues, and at the same time, there were a lot of companies who actually left the country. So there were medications, for example, Novartis had no longer an office in Lebanon. So imagine a medication like carbamazepine, okay, suddenly disappearing from the markets. Okay, this was really a big deal, and we had a lot of issues because patients would go to the pharmacy, and if the pharmacist was not there, or if there was any other employee, they would propose a medication that was not even an anti-seizure medication. So I got really like amazing uh, pictures of substitute medications that are, for example, a psychiatric medication or lithium, for example, okay, to replace carbamazepine. But what was interesting, when we sent the survey to patients, some of them did not really complete it. They would start, so we did not really include all these patients. We only included people who completed the survey, people who had the mental ability to do it. I mean, it was not a questionnaire that was addressed to caregivers. Okay, so. And if you look at the demographic data, a third of the patients who filled this questionnaire had a monthly salary of less than $100. Okay, so this is where you get to see not only the medical aspect, but also the social aspect. I had people who were pregnant, like a young lady who would be pregnant. And if I would request, for example, a levetiracetam level for her, it would cost $90. $90 is like a big amount. I mean, they can live for several weeks on $90 just to cover food and basic expenses. So I followed pregnant women without doing these necessary tests. Okay, so and here you can tell the burden of the crisis and how much it not only affected the patients, but it also affected us, because I would be looking at the lady and I would be like, okay, if I ask her to do this test, she'll be more depressed. Maybe she'll save the money to buy diapers for her baby. You know what I mean? So it wasn't easy. And even at that time, in the 2021, 2022, some labs stopped doing these tests because the kit would be expensive and they would just say it's not available.
Yeah.
So there were
Go ahead.
more barriers. There were more barriers for this.
Yeah. So basically, what you're saying is the barriers to access of medications, maybe changing medications. And in Lebanon, as you said, the pharmacists sometimes like you prescribe their own medicines to the patients. And then you have the barrier of like, are you able to monitor levels and make sure that the drug that you're giving and the dose that you're giving is the correct dose for the patient, especially when the patient is pregnant and there are some changes in the dosing that need to be done in that case. But I see that also that your findings were very alarming. There were 25% of the patients who reported having had seizure-related injuries between 2022 and 2023, and 36 to 37% reported an increase in seizure frequency compared to the prior year, 2020, which obviously affects their quality of life and everything. So these are big numbers. What do you think of those numbers?
I mean, this is the natural evolution of, looking at because if the medication is not available and you don't have, because there was the fuel crisis. And when we had the fuel crisis, you had to fill your tank in order to take your car and go from a pharmacy to another, trying to find your meds, So what people started doing is just cutting off on the dosages. So instead of taking, let's say, 3 pills per day, they would take 2 instead of, and this is when you have this reduction of your total daily recommended suitable daily dose. This is when we had more injuries because, of course, they were having breakthrough seizures and they were falling and when they injured themselves, they didn't even have sometimes the money to get sutured or to get CT brain or blood tests, blood levels done. So, of course, it's alarming, but I didn't find it too alarming. I was expecting this. And even now, since the beginning of the war, we are seeing, almost a new trend, because some people had to leave their house without taking their medications. So and with the displacements and changing environments, changing sleep habits. I mean, all of these stress, all of these are seizure triggers.
Right, and yeah, it's not only decreasing the dose of the medication, but also stress itself and lack of sleep
Mm-hmm.
can increase the risk, and especially if you're economically affected by what's going on around you and with the security situation, then you're not going to sleep as well, and your
Sure.
seizures are going to increase. So how did the patients, I mean, that was 2023, but it seemed like before the war happened, now things were starting to sort of stabilize in terms of the medical system and
Yes.
other economic points. So how did facilities and patients adapt to the situation, and did the situation get better in terms of taking
Um,
seizure medications?
well, yeah, I mean, what they tried to do, most of my patients were getting the medications overseas, as I mentioned. And we had a lot of neighboring countries. I mean, even Syria, even though sometimes we don't even know whether the generics that are coming from these countries are good. I mean, we didn't even know whether they were fake drugs at some point. So it was a major responsibility. Some people were getting it from Turkey, from Europe. We had patients who bought the medication on the black market, and this is when also, I mean, corruption is everywhere. Even we had a few pharmacies we were aware of that actually we're changing the medication prices. So if the medication would cost, for example, $5, they would tell you, okay, I would give you the box for $100. So whoever can pay this amount would buy it, and whoever couldn't afford it then would be in a big, in a big problem. And we relied as well on the donations. I mean, I'm sure as an expat, you know that there are a lot of people who would come from, Europe or other countries with their suitcase full of medication samples. And even in our, our NGO, we received samples from France, from Italy, from many other countries, and we were able to provide our patients. But I mean, I'm talking a very, a small number of patients. But we were able to, to at least to make sure that they're getting the minimum medication required. But of course, we changed our prescription habits. Okay, so there were the new third generation anti-seizure medication, for example, lacosamide or perampanel, or these medications were very expensive. So whenever a patient would come with, let's say, having lots of seizures, this is when we were back to the older molecules. Okay, even phenobarbital, which I haven't used for a while, I had to use it in a few situations because the patient actually couldn't afford a better or a new generation medication. So this was a major problem actually. Now what's happening? I mean, Lebanese people, we are known to rise from the ashes. I mean, but okay, we were rising, we were having a dip, and then we rise. But now I can't tell because what happened in 2023, we kind of have we re-baseline. Okay, so some medications were no longer subsidized by the government. So this is when the Ministry of Health said, well, okay, if you really want to import this medication, feel free to do it. Okay, so then the medication prices went up, but whoever could afford it is actually buying it. So if you can afford it, you take it, and it's available. Until now, it's available. But what's happening this month, after especially the last political and the attack on Lebanon. What happened is that people, because they're anxious, because they know what to do at times of war, they are stocking up on medications. So now I fear, like everybody, that within the next few months, we will have new shortages coming up. I mean, hopefully the airport will stay open so we can still import medications because, as you know, in Lebanon, the majority, I mean, more than 80% of our drugs are imported. So even the pharmaceutical companies that are based in Lebanon and they get the raw material from abroad and they just do packaging and a few other things in Lebanon. So if you don't really have access to the raw material and if you cannot import, then we will have a bigger crisis coming up soon.
Right. And part of the reason I think when the subsidies were there was people were buying them at much cheaper prices and then sending them somewhere else because then they can sell them for a higher price. And now it's better because of that. So that was my next question for you is, has the Ministry of Public Health, like when they intervened, is there like a change in policy or what public health measures were taken or would be recommended in situations like this, I guess?
Well, you know, it's really sad that our Ministry of Health didn't really have a full grasp of the situation, because at some point, even when there was drug trafficking and when they knew there were corruption here and there, nobody did anything to stop it. Okay, so you know, people just let go. So you have corruption, you have mismanagement, you have incompetent people sometimes that are in positions, in high positions, but they cannot really control things. And this is when, you know, things completely get lost. Okay, so I think that definitely now we have better regulation. For example, for some medications like chemotherapy, like MS medications, for example, for multiple sclerosis, regulations are good at this point. We have a platform and you electronically enter all the information. Patients has a number. We know exactly how many patients need this medications. But for epilepsy, the minister just decided that there's no point of investing or any program right now for this. So now patients with epilepsy who used to get the medications free of charge from the Ministry of Health has no longer any access to this. There is no medication in the pharmacy of our ministry to be distributed to them. And even at some point 2 years ago, we had some donations who we were aware of, who entered that pharmacy. Was a donation that came through WHO or whatever to the Ministry of Health, and the medication was not distributed on time, unfortunately. It expired and some people couldn't benefit from it. So this is where you know that there's a lot to do. There are some easy, simple solutions that can be done, and I'm sure that are applicable. And if they know how to apply it and if they know how to control it, it can work. But if you really don't have this program for epilepsy, nothing's gonna get done. Not soon.
Right, because what you're saying is you have an NGO, Epsilon, which is doing great work, but it's limited because you're doing it on your own. It's a private, and it's not necessarily private, but it's an endeavor that's not based on public policy. It's just an individual endeavor.
Yeah, and even when when we knew about the donation that was made to the Ministry of Health, we approached them. It's not that they really
Sure.
looked who's in the country. So we approached them. I got the first stock of medications. We distributed that, and then we got another one. But then there was a big stock that was left over, and it expired, and it wasn't given to any patient.
Wow. Yeah, that's
Yeah,
yeah.
that's
And
sad.
exactly, that's very sad. And so it seems like things have, I mean, things probably are better. We don't know the numbers now, but still, patients who cannot afford their medications or patients who don't have people outside the country to give them the medications are probably still
Yeah.
struggling to get the medications. So one thing we were talking offline too is looks like it was a good story about when you sent the study for publication. It seems like what happened, it seems like it was published pretty quickly, right? From what we were discussing.
Yeah, I was pretty affected by that because generally when you send your paper and the reviewer would be like, sending their comments or whatever. The I got a couple comments from reviewers that were really amazing, and I really thought when I was reading them, like, okay, I reached my target, because when I wanted to publish our study, I was thinking the world needs to know what's happening in other countries. The world needs to know that in some countries, a pregnant woman on levetiracetam or lamotrigine cannot get a drug level done like it should be done. They need to know how doctors also are struggling, not only the families and the patients. We are also struggling on what to do, on figure out the best care plan for our patient. So there was one reviewer who actually was interested to know what was the actual distance from, let's say, university hospital to villages in Lebanon, because they don't know. I mean, we are a small country. We live in a small country, but in some villages, patients have to travel 30 or 40 kilometers to get to a point of care, an adequate point of care. And when you do not have money to pay for transportation, when there is a fuel crisis and it's tough for you to get there, this is going to affect your seizure control, and this is going to affect your quality of life, like it did. So, actually, both reviewers sensed that, and I could sense it in their comments. And we actually they asked for minor changes, and we responded. We added some geography information to our paper, and I'm glad it was published, because I really wanted everybody to know what's happening around here.
Yes, for sure. Yeah, congratulations on the publication. And Dr. Abou Khaled, one last thing I think is how are you coping, and how are your residents and students coping with the current situation that's going on in the country?
Well, it's not easy. We are resilient. We are coping. It's not easy when you spend the whole night with like zero sleep, hearing strikes and worrying, or even being in the hospital caring for injured people, to get up in the morning, attend your course, give your lecture, go to clinic, listen to your patients complaining about what's happening. I have patients who were displaced, who were actually, they had their home, they had their house, their medications, and suddenly found themselves on the street. They had to leave their home in the middle of the night because of the threats of strikes. And when they moved from, let's say, the south of Lebanon to to another village, or they, most of the time, either they went to like refugee camps or schools that were set up for them, or they went to relatives. they forgot their medications home. They forgot what they were taking. I mean, I got messages, doctor, can you tell me what's the medication my dad is taking? And I'm like, they should know by now. You imagine that someone should have memorized the name of the drug. So because of stress, because of poor sleep, because of what's happening, they totally forgot what they were taking. And but I mean, fortunately enough, we still have communication. They can still reach the doctors, reach the pharmacist by phone, by WhatsApp messages, and take their medications. But it's not easy. And same for our medical students. I had to give a course, a talk on coma to third year medical students. So, and that was following the pagers, you know, when we had the pagers attack. And so I'm talking about coma, brain injuries, etc. And they were like, doctor, can you give us just more examples? Tell us what to do, because these were only third year medical students. They didn't know what to do, and they were, and when it happened, they were home, they were in university, and they panicked, and they were like, if something happened to a relative, if something happens to us, what should we do? So after I was done with my, formal lecture, I spent 40 minutes with them, just answering questions, telling them what to do when they see an unresponsive patient, what to do if they see a patient with seizure, because actually they might find themselves caring for patients like that at time of war before they are even trained to do it. And it was pretty emotional, but at the end we managed to get a selfie and post it on social media. And actually, this is how we kind of motivate each other, you know, as because otherwise, if we don't continue this approach, if we don't, I mean, personally, if I stop teaching and I stop publishing, I cannot survive. Because even now, in these, in these days, I've been more productive than other days. So because it kind of gives you, because you can't travel, you can't go to the beach, you can't party, you're not in the mood even to do this. So the only thing I can do right now is force myself to take care of my, mental health. I try to swim. I try to go walk in the vineyards, maybe on a Sunday, to gather some positive energy and start my week with positive thinking and spread motivation to my students and my patients.
Right. And on a positive note, tell us about your vineyard. How is it doing and where is it located?
Well, yeah, we're doing fine. We were actually getting ready to launch our Pinot Noir in October, because generally there is Vinifest, the October wine feast in Beirut, which was supposed to happen the first week of October, but then because of the war, it was canceled. So it gave us some time to maybe now to think about a better marketing strategy maybe for later. But we are enjoying our wine. So we have a farm with organic veggies. And when you're home at night, when because of the situation, we try to stay home, especially after 7 p.m. So you start innovating, cooking new recipes, new menu. So so far, this is the way we are trying to cope with everything that's happening around us, and hopefully we'll have a good ending soon.
Yeah, hopefully, it will be a good ending
Yeah,
for everyone, because I think
keeping fingers crossed.
people can last for so long, I think, and hopefully, I mean, you've,
Yeah,
yeah, I think people have been through a lot, but I think people are hopefully resilient enough, and things hopefully will end soon. Dr. Abou Khaled, thank you so much for being on this podcast, and it was great
thank
reconnecting
you.
and talking to you.
Yeah, thanks a lot and take care.